will watch the typical assessment of baby in 5 different positions at 1 month of age. We'll review the head, trunk, upper extremities, and lower extremities in each position. Additionally, make note of how alignment, core control, strength, and range of motion all give insights into baby's development. Let's get started.
Supine. At 1 month, baby's head is typically rotated to the side. The head cannot be maintained in a midline position for long because baby lacks head and neck control. We wouldn't expect baby to maintain their head and eyes in the middle until about 3 months old. Asymmetric tonic neck reflex, or ATNR, which is a primitive reflex in infants that naturally occurs, may be present. It is elicited through neck rotation, which results in this clip, in the arm near the face to extend and the arm near the back of the head to flex. Baby is also able to follow objects and faces from either side to midline. It is easiest to elicit visual following when object is presented from periphery to midline. Some trunk movement at this age is influenced by reflexes. Neonatal neck righting is elicited by baby turning head strongly to one side during the first few weeks of life. As seen here, this neck righting response elicits a roll to the side. At this age, we would expect the trunk to move asymmetrically. Here we see baby start in symmetry and move into asymmetry as the hips move, tilting the trunk to one side. Arms move with increasing variety on and off the surface and away from the body. You may notice the shoulders are less elevated compared to the newborn. Here we can see spaces emerging between the head and shoulders, showing more of baby's neck. The grasp reflex is elicited when an object or caregiver's finger strokes baby's palm, causing their fingers to flex, as seen in this clip. The hands can be either open or closed. Persistent clenching of their fists may be a cause for concern. Here we also see another example of the grasp reflex. Baby exhibits a variety of kicking movements and starts to bring their legs off the surface. While some kicking may occur, baby's legs are typically flexed and rotated out to the sides. Prone. At 1 month, baby's head turns primarily to one side and rests cheek on the surface. At 1 month, baby is able to use neck extension to lift and turn head to clear airway. At this age, you want to be looking for baby to use the muscles on both sides of their neck. Using a toy to direct baby's attention helps initiate head movements. When looking at the trunk, the hips are usually positioned above the head. This is due to hip and knee flexion. As trunk and hip extensor muscles strengthen, the hips move into a less flexed position. Baby's arms flex and are positioned next to the trunk with elbows behind the shoulders. As baby progresses through the first month, the arms start to move away from the trunk. The legs are primarily flexed at the hips and knees. We also expect to see some kicking and increased extension. The ankles flex and you may notice baby pushing toes into the surface. Side-lying. At 1 month, the head is typically in line with the trunk and hips, making the body look as though it is in a straight line, as the therapist points out in this clip. While typically the head is in line with the body, it may also be observed slightly behind the shoulders. While in supine, head turning can elicit the neonatal neck righting response, causing baby to roll to side-lying. There is typically a line from the head to the trunk and down to the hips. While looking for this line, it is important to remember baby cannot maintain this position independently. If you remove your supporting hand, baby will fall either onto their back or stomach because they do not have the trunk muscle strength and control to maintain this position by themselves. Arms remain close to chest and in midline. This gravity-eliminated position provides more chances for baby to play with hands together in midline and bring their mouth to their hands. The fingers may be closed or gently open. Legs typically flex up towards baby's body. The bottom leg should be in contact with the support surface. The top leg can rest on the surface as well, or it can be in contact with the bottom leg. In this clip, baby's top leg is in contact with the bottom leg. Legs get tactile input where they touch the surface. Sitting. At 1 month, baby may make attempts to hold their head over their body for brief periods of time if they're given proper support aligning their trunk over their hips. While baby's head is not sustained in midline, the tilting should not only be to one side. Baby should be able to move their head to both sides. Core strength and control needed for independent sitting is not sufficient until after 6 to 7 months. Until then, maintain support on baby's trunk while assessing in this position, because they will fall over. Baby's trunk is inclined forward with weight bearing on baby's sit bones. Notice the baby's buttocks is flat on surface and bearing weight on their sit bones, instead of leaning back and weight bearing on their lower trunk. Baby's arms move in and out of flexion and extension at the elbows. The wrists are extended and hands are loosely closed. Baby's hands should not be tightly fisted. Legs are typically flexed at the hips and knees. They are loosely rotated outward, and the upper thigh does not rest flat on the surface. The legs do not provide any functional stability in sitting at this time. The feet and ankles can also be in a variety of positions. Here we see baby's ankles are flexed and the feet come together. Standing. At 1 month, at this age, we would expect head lifting to occur repeatedly for brief periods of time so that chin does not continually rest on chest. The head is not always in line with the trunk. Baby shoulders are slightly elevated. We would expect shoulders and trunk to be inclined slightly forward. The buttocks may be forward in line with or behind the shoulders, and the hips are often flexed. At this age, we would expect the elbows to be flexed. There is little variation in baby's arm movements at 1 month. Notice knees are flexed and appear slightly bowed. Baby will often exhibit variable leg movements in standing. Feet are flat on surface and close together. The feet may cross each other, but this should not be persistent. Automatic stepping may occur when baby is leaned forward, noted by baby taking alternating steps. Baby will alternately lift their lower extremities, placing them one in front of the other, as if stepping. Variable leg movements will also occur. The creation of this course would not have been possible without the expertise from therapists at pathways.org and in Robert H. Lurie Children's Hospital of Chicago and Easter Seals DuPage and Fox Valley.
Thanks for watching. Be sure to like and subscribe to our channel and check out our other social media accounts in the description below. It's never too early or too late to get baby on the right pathway.